So, hello everyone. I am Pastor Cooper over at ourspirit.online, and we're bringing you another part of our series called Civic Seminary. And today we want to talk about the mental health effects of trauma and how this COVID has really impacted the people and what we should be doing as pastors and how to identify certain situations or warning signs. So we want to talk about all of that today. And I have asked for the very well and able support of Dr. DJ Robinson to facilitate this session, and she'll introduce our guests. So I'm going to turn it over to you now, Dr. DJ.
Hello. Thank you so much, Reverend Cooper, for that warm and welcome. We want to thank all of our viewers for joining us right here on ourspirit.online. This is our Civic Seminary, and we have today Dr. Myra L. Mathis. She's an MD. She works at the Department of Psychiatry for URMC. So, Dr. Mathis, welcome to this broadcast.
Thank you so much. It's wonderful to be with you all.
So, listen, I am so excited about the conversation that we are going to have this evening because
I gotta say this. I knew her before she was a doctor when she was just a worshiper.
Okay. Well, our worship is essential, right? Our worship is essential. And so I'm so glad because I was able to attend Colgate and your mom was there. Yeah. And she was a great mentor to me. She was a very wonderful encouragement to me. So God bless you. God bless your family. And once again, thank you so much for just taking out the time to talk with us about some of these pressing issues that are facing our community today, right? So let's just go ahead and get started. The psychological effects of the quarantining and the pandemic and the panic with the pandemic. My daughter, she's getting a lot of information from social media. Yeah. And so that creates a what we would call a spirit of anxiety. She said, "Oh, mom, I heard that those needles for the vaccine were really, really big, and so for people with needle phobias and things of that nature, they don't really want to take this vaccine. So for us pastors, to ease that anxiety, right? What are some of your feedback, some of your suggestions? I'll just let that go. Like even for parents, how do we deal with the anxiety around this pandemic?
Yeah. So the anxiety around the pandemic is huge, and it impacts each of us, right? So there's the anxiety that we are experiencing through our children, through our youth. There is the anxiety that adults feel, right? So there is a discomfort. There can be a discomfort, or at least a lack of awareness, or this feeling of the unknown related to both the pandemic and also to the vaccine. We are in a once in a century situation. Nothing like this has happened in most of our lifetimes. And so we don't know what to do, right? And when you are confronted with a situation that is so foreign, your mind is trying so hard to make sense of it, trying to relate it to experiences that you've had before. But we haven't been this way before, as the Bible says. We haven't been this way. And so we are relying on coping mechanisms, or at least we're trying to reach for coping mechanisms that used to work. And unfortunately, some of the mainstays that we would have, like, for example, gathering together in congregations, that is a mainstay for helping us when we are faced with situations we don't know what to do with. We gather together in our churches, in our places of worship. We find community. And we are able to navigate things because we have a space to express that. But during the pandemic, we haven't had that same space to express that. So when it comes to anxiety, first I'll talk about the parents and I'll talk about the adults, because if we're feeling anxious, the kids will feel anxious. So, and this is particularly true for younger children. So when you're thinking about sort of preschool, kindergarten age children, they are incredibly sensitive to the anxieties and the worries of their parents. And so if we aren't able to think about healthy ways of managing our own anxieties, then that does spill over into to our children, and they will feel even more anxious because we are their safe place and we help create an environment of safety for them. When you think about children that are a little bit older, so some of your school age children, maybe around 6 to 12, they are able to understand a little bit about the virus. At least they understand that people get colds, right? And so if people get colds, then that's how germs are spread, and maybe the coronavirus is something sort of like that. And so they're able to understand a little bit. And what really helps distill the anxiety is to validate the feelings, right? While also providing accurate information. So we as parents have to access accurate information for ourselves. We have to be mindful of what we're looking at on social media and who the sources of information are. And we have to think about how we're vetting credible information about the vaccine, credible information about the virus. What institutions are we reading from? Is this a forward from a friend who is reading on some like undocumented website that they found when they went on a YouTube trail that took them about 50 pages in? That's probably not the same thing as information from credible health agencies. So as parents, we need to educate ourselves. We need to think about how we're managing our own anxiety. And then when we're talking with our kids, we validate their feelings because the anxiety is real. We can't pretend like it's not happening. We're stuck in the house. We can't pretend like it's not happening. They're not going to school in the same way. We're not going to church in the same way. So we have, and they will know when we're not being honest. So we have to validate their feelings, and then we ourselves access credible information and think about how we can titrate that information for our children.
But what's that fine line when it becomes more than a concern? You know what I'm saying? And when, I guess that's the question.
So I think in your question is, we all have worries, right? And we all get anxious. Right. And when does it cross the line over into something that's a clinical anxiety disorder, clinical. Right. So that's a great question. And so there are various criteria that we use to help us distinguish what is like general worry that everyone feels versus what is a diagnosable anxiety disorder, or general sadness, which everyone can feel, versus what is diagnosable as depression. And so we have to think about the other symptoms that go along with that. So your child may come to you and say they're worried about something or they're scared about something. Are they also having trouble sleeping? Has their appetite changed? Are they unable to engage in even the activities that you've established within the house during the pandemic? Are they isolating even within the house? Are they staying in their room more? And so you're looking at other behaviors rather than just the expression of a worry or the expression of an anxiety. You're thinking about other behaviors that can indicate that there might be something more going on. And we're also looking at the time course. So we can be anxious or worried for a couple of weeks even. But if that stretches out into months, and if the change in their behavior stretches out into months, then that's when we need clinical intervention. So they're not able to be reassured by all of the things that we talked about. You know, mom is doing her part, making sure she's, navigating her own anxiety for herself in a separate space. Mom is accessing good information and trying to reassure the child. But regardless of whatever mom or dad is doing, the child is not being reassured. And that's when we've got to ask ourselves, there might be something more going on.
Yeah.
Awesome.
You know,
You talked about something that triggered me to kind of not to move too fast out of this category, but you talked about that general sadness versus depression, right? And I did some research, just a few things, and my concern, of course, I'm coming from a pastoral place, but also as a mom, as a parent, right? Because we have a lot of parents that go to our churches that want to get these answers, and so blue light, when we're in front of the computer screens for a long time, right? Our children now doing the remote learning, even if they're not really on the computer screens, but near the computer screens or our cell phones. Can you share a little bit about, does that affect our sadness or our brain waves or anything like that?
Hey, before you answer though, I want you to take me back to elementary. What's this blue light about?
What is blue light? Okay, we got to explain blue light.
So I could start there in terms of what blue light. So blue light is the light frequency that's emitted from our electronic devices. So it's the kind of light that it comes from, essentially your screens, your computers, laptops, televisions, cell phones. It's the type of light that is emitted from those screens. And this is the particular, like the frequency of the light does not have the same spectrum that natural light contains. So natural light contains the full spectrum of all, like Roy G. Biv, all of the colors of the rainbow that's contained in natural light. But our screens only contain blue light. At least they have a higher concentration, so to speak, of blue light compared to all of the other frequencies of light. And so that means even though we're being exposed to light waves, we're not being exposed to natural light. And the biggest impact that this has is really on our sleep cycle. So because we're being exposed to light, our brain is getting confusing messages. The brain is getting exposed to a light signal that says, be awake, be alert, be on all the time. But it's not natural light, and it doesn't.
And the blue light says, be on.
Yes, it is. It sort of excites your brain. It's one of the reasons why phones are so addictive, right? That it really draws you in, it excites your brain, and it tells you to, it's basically a signal that says stay awake, stay alert. And we are not made to be on all the time. Right. So Zoom fatigue is a real thing. Like I could have a day of meetings, but if I'm sitting in a room with people, there are so many other things happening in that room if I have a day of meetings, rather than a day of meetings sitting in front of a screen in my house or in my office by myself. So there is both what's happening through the light itself, but also the fact that we're experiencing it all in isolation. So we are sitting in front of a screen, but we're also physically disconnected from people. And so we are not having the same kinds of social connections and social interactions that we would typically have during our work day, our school day, etc. So the combination of those two things really does lead to Zoom fatigue. It really is draining on your mind. It's draining emotionally because we're not getting the same sorts of positive feedback that we would get in a usual setting. So that's one aspect of the blue light. And then when you contrast that with natural light, which of course, in Rochester, in upstate New York, in the wintertime, we're already not seeing natural light. We go months and months and months of many gray days. And so seasonal depression or seasonal affective disorder, that is also a real phenomenon where people tend to have more depressive symptoms during the months when there is less sunlight. Because our body does respond positively to that natural light.
Yeah.
So when you have the combination of only being exposed to blue light, sitting in front of the screen for hours and hours and hours, and doing that in isolation. And you combine that with the fact that we're not going outside, we're not spending as much time outdoors. But even if we were at this time of the year, there would
Right.
be no sun to really to speak of to meaningfully give us that kind of exposure to natural light that could lift our mood. And so the combination of those two things, um, certainly it impacts our mood. Seasonal affective disorder definitely happens, but it also impacts our sleep because that blue light, that constant on signal, keeps our brains from being able to dial back and actually rest.
Wow. Okay. I
So
feel
when we
smarter. I feel
yeah,
smarter already.
listen, this is really good stuff because it could be, Pastor Cooper, when we were talking a little earlier, most of the church services are now virtual as well.
Right.
So people by the end of the week, if they've had 5 meetings, back to back on Zoom, the kids are on in front of the computer screens and even PlayStations because they're trying to,
Mhm.
fill those social voids
Yeah,
however they can.
yeah.
And then now your brain is constantly on. Um, from what I understand, there are some chemicals like endorphins, like epinephrines and cortisols and stuff that what is it that makes you
So
dopamines,
yeah.
things of that nature. And they're stimulated, and then not getting the rest. The parents aren't getting the rest. Then we got to go to church on Sunday morning, and that's on Zoom too, right?
Yeah, that's true.
It's so what I'm saying is this blue light is really affecting us mentally and physically, right? I talked to Dr. Shani and she gave us some answers about how sitting in the same spot, your poor blood circulation, things of that
Yeah,
nature that really have something to do with like our physical health as
right,
well, right?
right.
So physical and mental health is really at effect. Those were the basis of my questions, is just to how is this really affecting us, and the anxiety, what to do about the anxiety, what to do about the depression,
Yeah.
and then understanding what factors are contributing to the trying to do that balancing act
Mhm.
between the anxiety and the depression. I really don't want to go outside, but I can't take it in the house anymore, you know and then we said something earlier at the beginning portion. I think, I'm not sure if we have it or not, but we talked about being able to meet together in the churches, right? So
Mhm.
let's go ahead and take this a little bit, because I know who your mom and your dad is. So let's go ahead and take this, let's get a little churched with this.
All right, we
um
can do
the
that.
Bible tells us, do not forsake,
The
right,
assembly
the
of yourself.
fellowship of
Mhm.
the saints. And with me, I feel that worship is therapeutic.
Mhm.
And you mentioned, you touched on that just a little bit.
Yeah.
So what would be some of your since worship, being able to articulate feelings, and I'll take you to Sigmund Freud, I believe it was. He had something called the talking cure.
Mm.
Being able to articulate what you're feeling and being able to
Mhm.
say, even in song and worship, things
Yeah.
of that nature. We haven't been able to do that.
Yeah.
So can you tell me just something for people to understand why being able to talk, like you said earlier, validating those
Mhm.
feelings,
Mhm.
right? When we come into worship, go ahead, I'm gonna let you take it because I don't want to take it. So but when we come into worship and we sing songs,
Yeah.
we are actually voicing and validating our
Mhm.
laments, our
Mhm.
cries,
Yes.
right?
Yes.
And so how important is that for
Yeah.
our psychological wellness?
Yeah. So that's really powerful. And what is particularly what you said about the validation of our laments and our cries. Um, Worship isn't about glossing over everything as if everything is all right. Worship is about being present with our pain and still bringing that before the Lord. And that is therapeutic. that's the kind of environment that a good therapist would want to create in their office, right? And the Bible, since you took
Let's
us
go
to the
there.
word, we might as well go there. But the Bible calls Jesus the wonderful counselor,
Right.
right? The
Right.
wonderful counselor. So, so for me, that is that means that there is something in his nature that should be reflected in the way that we engage with our mental health and wellness.
Mhm.
And and so when we bring our laments before the Lord, we invite him to be present with us in our pain. And not only that, but like you said, we're in the congregation.
Right.
And so we are feeling that experience collectively and not in isolation.
Right.
And that sense of social connectedness really is a buffer against symptoms of depression. It's actually one of the aspects of a clinical work that is studied about the importance of social connections to be a buffer against depressive symptoms.
Yes.
And that is what we experience in the congregation, in the coming together, the relationships that we build, the conversations that you have after church has dismissed and you talk with somebody and they're in the same place that you're in and you know you're not alone.
Right.
Those moments are really they help to build a psychological buffer when we are faced with an onslaught of trauma and various situations that induce anxiety or can induce feelings of depression. So yeah, that it's a powerful thing, and it is something that we're missing right now.
Yeah.
Because we're not able to do it in the same way. And we joke about Zoom church, but you got to find something somewhere somehow.
Right.
to at least to help you not feel so isolated. But I would take that a step further and say we also just have to pick up the phone and call somebody.
Right.
So we're getting really comfortable with seeing everybody in Zoom meetings, but we're not necessarily having heart-to-heart connections
Right.
in a Zoom meeting. And so you do want to pick up the phone and actually have have a conversation, because those are the small interactions that happen when we're in a congregated setting that we're no longer having. Like we can sing the same songs over Zoom, but we may not have that intimate conversation.
Yeah.
So let's pick up the phone and let's actually start talking with one another so that we're not letting ourselves succumb to that isolation.
Awesome.
Yeah, I remember I saw it on television. I don't know if it was YouTube or what, but the grandmother wanted to hug her grandchildren, and they built this big plastic thing, and she stuck her hand through there, and then the kid came up. There's just nothing better than the human touch. I mean, it's so much needed. And my concern is that people will get used to this. After a year, you know, because it'll be a year before we are really back in church, you know. And there's a certain population of people that aren't gonna so easily just come back. How do we reach those people? What do we say? What do
you do? Yeah, that's a great question. And it is a reality. And it's something that mental health professionals are aware of, right? That people are talking about the mental health tsunami that is coming on the backs of this pandemic. And to be perfectly honest, in my role as an advocate, what I'll say is we don't have the clinical infrastructure to manage the needs. So we need more clinicians, we need more therapists, we need more mental health care providers, and we need folks who are culturally responsive enough to be able to engage with the sort of endogenous and grassroots communities that are within the broader community. And that for me is definitely the church. The church is a support system that's already in place. And we need mental health care providers who are able to partner well with pastors to offer them that support. And that's a part of my, that's something I'm very passionate about personally. So I'll leave that as an aside so that if any mental health care providers come across this, that they take that and run with it. But in terms of what pastors can do, in terms of what leaders can do, to be aware and acknowledge is one of the first steps. To actually voice that and hold that in mind, that for some people, it's going to be harder to re-engage than for others. And to not judge them, to not, to not be so dogmatic in a sense that you're saying, well, you must not love Jesus if you're not if you're not coming to church, right? So let's acknowledge the reality of that and not take it as a knock on someone's spirituality or a knock on someone's connection with the Lord or a knock on the fervency of their faith, because they are struggling with re-engaging when we're able to re-engage. So I think that's very important, because the last thing you want to do for someone who is struggling is to then add that kind of judgment and add that kind of shame that will only further isolate them. It'll leave them feeling like they have no one to turn to when they're finally ready to come back in. So you want to be sensitive to that. You want to be aware and don't push them. Don't push them.
Yeah. Okay. Just let it happen.
Let it flow. Be available.
Be available. Yes.
Okay. So maybe one approach would be, before we just go full blast, have smaller groups meet for certain things.
Yeah.
Like, stuffing grocery bags where it's just 5 people.
Sure.
And kind of acclimate them back that way. Or doing our services very small and just adding people over time.
So I think both of those are great strategies. And what you're doing in that, you're modeling a few things actually. So one, you're modeling safe practices, and you're letting people know that you take their health and wellness seriously by being thoughtful about how you are reintegrating into a more physical gathering space. So that's wonderful, and that's something to consider. And you're also giving people an opportunity to engage at whatever level they feel comfortable. And because you say you're keeping it small, then it doesn't leave the others feeling judged if they're not coming, because they know it's only a small group right now, and later on things will open up. And it gives them time to sort of prepare. So like as you're reopening in phases, they can look ahead and see, well, I still have a little bit more time to get ready, a little bit more time to get used to it. The concept actually in that is something called exposure therapy. So if I were working with someone who has agoraphobia, which is a fear of going out of the house, and a lot of people are developing that in the setting of this pandemic,
right?
Then you take, then a therapist would give them small things to do slowly to help them reacclimate. And so for people with agoraphobia, if they go outside of the house, they have an unbearable sense of panic. Their heart is racing, their palms get sweaty, they can't breathe. It can feel to them as if something is definitely wrong with them. And so then they quickly get back to their home where they feel safe and they're calm.
Yeah.
What you would do with exposure therapy is say, open your door and stand outside your door for 5 seconds. So you'd ask a person, when your anxiety is at a 10, what would it be that left your anxiety at a 10?
Yeah.
And then what happens when your anxiety is at a 0? And you develop a scale for them right? And then you pick something that's like a 2 or 3 and say, all right, this is what we're going to try today.
Mm-hmm.
And as they are exposed to that and they're able to do that safely, their anxiety decreases and they can keep moving up on the scale. So, in a sense, what you're creating is the opportunity for someone to titrate their exposure slowly but surely so that they are reacclimating to the setting. Not everyone will be able to come when you have a group of 5 people stuffing gift bags. However, you're allowing an opportunity for people to gradually increase their engagement.
Yeah. Yeah.
You know what I think about when I hear you say that? There's a scripture text. The Levites were responsible for always keeping the temple open
Mhm,
and keeping the lights on.
mhm.
And they went in shifts. They were in shifts, right? So, I mean, just because one church is not open on Sunday per se, doesn't mean that there's not a small group happening somewhere else that's open on a
Mhm,
Tuesday or
mhm.
something of that nature where people can congregate and come together. But I think with keeping the temple open, um, is where I think that we would find the most. I've learned some new terms. I've learned exposure therapy. I've learned modeling. I got my notes here, sister. I got so what I want to do is I want to find out. I know, once again, we want to give this disclaimer that if people have a primary therapist or something like that, that they should definitely grasp the information and follow up with the information with them. However, like you said earlier, there may be some clinicians, there may be some people who feel just as passionate about this topic as you do. And we want to offer you an opportunity. How would you like for people, if they wanted to follow up after this broadcast, would you like for them to contact us or contact you? Or how would you like for people to get in touch with you if they had an interest in coming alongside you to kind of help us help the people?
Sure, sure. So I can be reached by email at Dr. Myra, so DRMYRA dot Mathis, Mathis, at gmail.com.
Awesome. Awesome.
And as you gave that disclaimer, some folks may reach out to me in hearing that information with a personal a concern related to their mental health or wellness. And I will just echo that I am not in private practice right now, so I'm not able to take on individual cases in that way. If you're looking for resources, I'm happy to help you find other resources, but I'm not able to be a primary therapist in that way at this time. But if you're trying to figure out where to go next, I'm happy to help you to and connect you to the next step.
Awesome.
I have some more questions.
Yes.
All right. Okay. So, I was blessed to be in the right place at the right time, and I got my Moderna vaccine.
All right.
I'm
Congratulations.
to be there. I got my okay. So inevitably, every time I see someone and I say, "Well, I got the vaccine," the question is, "Well, how do you feel?" As if I'm gonna, pass out or something like that. So it seems like people, when they hear of something negative, it undoes all the positives. How do we deal with that? And the other people that seem to just not take this thing serious?
Oh, that's a big question. That's a big question, and I appreciate you asking it because it's something that we've struggled with for the last year.
Right.
In terms of our communication and messaging, in terms of helping people understand, um, I would just say, um, well, first, let's go to the vaccine. I'll reiterate what we said before about credible sources of information. And there are some webinars. I don't have the URLs offhand, but I can certainly send them to you, where there are, particularly for the Black community, I'll say Black physicians who are getting into the details about the vaccine
Yeah.
and helping members of the Black community really understand what the science is, what the risks are, but also the great benefit to them as an individual, but also the benefit to us as a collective. And so there is good information out there, and there's good information by sources that some folks might consider more credible than what they're hearing on CNN, for example. And so I think being able to offer someone that credible information is important. I think it's also important, you want people to be informed about what might happen, but they're also talking to you and you're still standing. So even if so even if you had some arm soreness, or even if you felt a little under the weather the day after the second dose, which is a common thing. Some people have I feel a little under the weather the day after the second dose. What that means is your immune system is responding. That means your immune system is gearing up so that it can be armed whenever, if ever, you are exposed to the real thing. So it's actually not a bad thing to feel a little bit under the weather after the second dose, because it means your immune system is working and doing what it needs to do.
That means you're alive.
It means you're alive.
So to have a few side effects than on a ventilator.
And that's a real thing. That's a real thing. So what we're looking at in terms of the risk of the vaccine versus the potential risk of exposure to COVID-19 and the very significant health outcomes that can result for healthy people. I know of very healthy people who have had life-threatening complications from COVID. And so that's what we're trying to prevent. That's what we're trying to nix. And the vaccine is a tool that we have to actually do that. And we don't want to leave any tool unused when we are fighting a once in a century pandemic.
Right.
I think that also our attitude sometimes has a big contribution to how our body's immune system actually works. And I'm taking this back into less of a physiological place, but more of a psychological place. That I've read a few places, and I'm pulling it just from my brain, that people, like for instance, they have had research on cancer studies. And they've said that people who have had always a positive outlook or something like that, the chemicals that are released from our brains, or from I forget all of the technical terms, but I don't have them in front of me. But basically, that the mood chemicals actually help your immune system or give you that boost that you actually need, as opposed to if you were doubting and negative and putting things down all the time, then of course, medicine, it's never going to work for me, I'm the woe is me, I'm Eeyore from Winnie the Pooh, and so do just a little bit on that, because I know we're running toward the end, but a little bit on that about the mood that people maintain, as far as, how that's connected. I know it's interconnected some kind of way to how our bodies actually respond to things, right? So like, and I'll give you one last example, just try to sound smart. What I was reading the other day is that when I think it's called the frontal lobe, when it is activated, that people, if they're feeling a threat or if they're feeling something, there's three responses. There's fight, flight, or freeze, because the adrenaline starts to pump, right? So I'm making the correlation, and I'm asking you at the same time, as far as the mood, right? Can that same technique be used? If we have a positive outlook, can that actually help our bodies fight off infections, things of that nature?
That's a great question. And I would say that there are, similar to what you said, certainly there are studies that demonstrate a correlation between the positive outlook of particularly cancer patients and the effectiveness of the treatment, or at least the length of time that their survival time. Right. There's a correlation between their positive outlook and their survival time. Awesome. So that has been documented. The research into the interconnectedness of our immune system and our neurochemistry is still burgeoning. And so there are lots of little connections. There are lots of connections. We're unsure what they mean or how to interpret them, but they are present. And so we know that the immune system and our neurochemistry interact in a variety of ways.
Yes.
And they impact each other in a variety of ways. But it's hard to say what a specific thing will or won't do in any given situation. However, you feel better when you think better.
Right.
Yeah.
You just do.
And
Right.
I think,
You just do.
yeah, I think that that's important because for when we go to theologically speaking, give God thanks. That does something when we say thank you and we have that attitude of gratitude. And when we start to thank and so, you know, I know we're getting ready to close, but I guess if I'm going to close, you know, where he says God can do exceedingly and abundantly above all that we can ask or even think. When we start to recite those type of things, especially in a communal atmosphere and the trigger, the vibrations, the words that actually come out of some of the songs that we sing and those places of worship, that is the healing that it does something to us. It activates us. It gives us that mood altering positivity, something that whatever healing we need, it can begin there. And that's just me mixing the theology, the psychology, the physical, because God is the master of all of it, right? So and all. And so I just am so thankful for this exposure therapy that we had today and getting out of the isolation. I got tons of sermon topics
One more question.
Yes, please.
One more question. Okay, so you know, in the Black community, getting counseling or psychological help is stigmatized. And it's difficult to get people to go to a therapist or a counselor or a psychologist. Have you seen any techniques that we could use to help people get over that stigma and get some help?
So I'll share a few things. So on the one hand, there is stigma. And then on the other hand, there are systemic barriers. And I think both of those contribute to folks not getting help and not accessing care. In terms of stigma, I would say our young people are showing us the way. And there is a younger generation who is recognizing the importance of mental health, and they're having open conversations about it. And so the biggest thing that you can do is take it out of the shadows and bring it front and center. So actually have dialogue about it, and it's not something that we're whispering about in the back corner, you know, so and so started seeing a therapist. No. You're open about your own mental health care journey. I'm open about, I am a psychiatrist. I see a therapist. I have an appointment every week, and I don't miss that appointment unless my 4-month-old son is having a fit and he won't let me escape. But things like that, being very open about our own mental health care journey and taking the conversation out of the shadows, bringing it into the spotlight, that in and of itself helps reduce the stigma because it normalizes it. That I'll give you a few statistics. 1 in 5 people have a mental health concern at any given time. 1 in 5 Americans. Over the course of a lifetime, 1 in 2 Americans will have a diagnosable mental health concern. So you just think about a husband and a wife. One of them, by statistics, could have a diagnosable mental health concern over the course of their lifetime.
Yeah.
And so just knowing that and accepting that as a reality. Don't look over to your left and to your right every time, because you might need to be looking at yourself. but recognizing that it is common. It is common, and we need to bring the conversation into the light.
Yes. Awesome. Thank you so much. I'm so glad. Well, listen, I hope, because we have a baby boom on the way. I want to talk about that. Well, I'm just saying, for the next time we have you on, Dr. Myra, we definitely, and you know me, I'm all about, not being biased or anything, but I think we need to look at those family dynamics and what postpartum depression does to a family, because I know that the quarantine has made I've seen a lot of baby bumps running around. And so we're getting ready to have to deal with that as well in the church.
I just want people that name their babies after it.
Oh, Lord. Covida.
Please don't. Please don't.
Quarantine. Well, listen.
So, before we go, I just want to second what you said about gratitude.
Yeah.
And I think that is a really great place to close, because there is actually a little bit more data related to gratitude and how it impacts the serotonin levels in your brain, how it really actually boosts your mood. And a daily practice of gratitude is something that is recommended by psychologists, by therapists. And so the Bible says, in all things, give thanks. And that's something that we know from a mental health care field that does impact your mood. It does actually buffer against symptoms of depression. And so if there were anything that we take away from this time, yes, the pandemic is changing our lives in innumerable ways. But each day, if we can genuinely find something to be thankful for, and not just say thank you because you have to and check off a box, but take a moment and think, what can I be thankful for today?
That's good.
That's good stuff. Listen, thank you so much, Dr. Myra Mathis. I'm so glad to have you. I'm going to turn it back over to Pastor James Cooper so he can close us out. But I'm so thankful, and we hope to have you back soon.
Well, thank you for having me. It's been a pleasure.
Thank you so much for doing this. I'm so proud of you. Proud of you. And and now you've got a 4-month-old. And wow. I think you were still in high school when I met you.
I probably was.
Not that I've gotten any older or anything like that, but so grateful for you. Thank you so much. Thank you so much, Dr. Robinson, for facilitating this. And until next time, this will be continued. God bless you, everyone. Bye-bye.
Yeah.